So the last part of this lecture is that you need to know that chronic allergic fungal sinusitis can be a part of cystic fibrosis. However, chronic sinusitis with sinonasal polyposis can be a part of Kartagener syndrome. So once you detect complete obliteration of the paranasal sinuses, you need to look at two. You need to look at the lungs and the epigastric area. Okay, why you need to look at the lungs? Because if you see upper lobe bronchiectasis, this is mostly cystic fibrosis, and this chronic obliteration, this complete obliteration of the paranasal sinus is mostly fungal, chronic allergic fungal sinusitis, and you are expected to see pancreatic lipomatosis when you look at the epigastric area. This is the pancreatic lipomatosis. I've uploaded a video to know how to detect the pancreatic lipomatosis on CT scan, and I mentioned that you need to focus on the splenic vein as it running on the superior border of the pancreatic body. Okay, so if you didn't see any parenchymal tissue, this is fatty infiltration of the pancreatic parenchyma, and this is called pancreatic lipomatosis. Okay, and pancreatic lipomatosis increase the possibility of cystic fibrosis. Again, you need first to look at the lung. If you see upper lobe bronchiectasis, the complete obliteration of the paranasal sinus is mostly fungal, and you are expected to see pancreatic lipomatosis if you look at the epigastric area. However, if you look at the lung and you see lower lobe bronchiectasis, okay, the complete obliteration of the paranasal sinuses should be sinonasal polyposis. Okay, and if you looked at the epigastric area, you will see situs inversus, right-sided cardiac apex, right-sided aortic arch, right-sided spleen, left-sided liver. So, and this is called Kartagener's syndrome. Okay, how to memorize? First, look at the lung, lower lobe bronchiectasis, then the complete obliteration of the paranasal sinuses is mostly polyposis. And then if you looked at the epigastric area, it's expected that you will see situs inversus, and all of these are Kartagener's syndrome. This is, I think that's all. How to distinguish between chronic allergic fungal sinusitis and chronic sinusitis with sinonasal polyposis. Clinically the same. Asthmatic patient or allergic rhinitis, patient with allergic rhinitis, complaining of frontal headache. Okay, so on CT scan, they share the same criteria of complete opacification of the sinus with a soft tissue mass is seen causing widening of the maxillary ostium and extension into the nasal cavity. Extension into the nasal cavity. Okay. So they share these same criteria if they involve the maxillary sinus, complete opacification with soft tissue component, causing widening of the maxillary ostium and extending into the nasal cavity. However, in chronic allergic fungal sinusitis, they cause marked expansion of the sinus with thinning of its bony wall or even erosions of the bony walls without extension. This is not invasive form. This is only chronic allergic fungal sinusitis. The main problem of the chronic allergic fungal sinusitis is the marked expansion of the sinus by the fungal material with thinning of its bony walls and even erosion. Marked expansion of the sinus with thinning of the bony walls or erosion. However, in sinonasal polyposis cause only mild expansion of the sinus, okay, with no bony thinning or erosions. Why? Because sinonasal polyposis is only mucosal polyp. Is only mucosal polyp. Okay. So here, if you compare the bone thickness, this is the same thickness of the bone, no bony thickness here, no bony thinning here or erosions with sinonasal polyposis. Okay. The next difference in between, okay, sinonasal polyposis on, the next difference here, chronic allergic fungal sinusitis cause engulfing of the nasal turbinates while extending into the nasal cavity. It is engulfing the nasal turbinates, while the chronic allergic fungal sinusitis extending into the nasal cavity, it is engulfing the nasal turbinates. Okay, can you see here the nasal turbinate? Here it is engulfed by the fungal material. However, here in sinonasal polyposis, there is hypertrophied nasal turbinate. Will be hypertrophied. The nasal turbinate will be hypertrophied, indicating nasal polyp. Okay, so here in sinonasal polyposis, if you see sinus polyps, the sinus polyps can be associated with nasal polyps, okay, and the other polyps in the paranasal sinuses, okay. So here the complete opacification here is most likely other polyps. This one is nasal polyp, okay. After that, you need to know that chronic allergic fungal sinusitis on CT scan appears differently than the sinonasal polyposis. Okay, so chronic allergic fungal sinusitis will show areas of hyperdensity, indicating the fungal material. The fungal material is full of minerals of high density. So on CT scan, the mass or the soft tissue mass will show areas of hyperdensity. However, the sinonasal polyposis, it is only mucosal polyp or mucosal hypertrophy, so it will be isodense on CT scan. On MRI, Chronic allergic fungal sinusitis contain fungal material. The fungal material will characteristically appear on T1 as high signal, will show high T1 signal. So the soft tissue mass will contain areas of high T1 signal and very dark T2 signal. This is another criteria. The fungal material appears very high or appears of high T1 signal and very dark T2 signal, and does not enhance on the post-contrast images because it is only a collection, it is only a material. So it will not enhance, this is not a mass. So it will not enhance on the post-contrast sequences. Okay, so how to distinguish between the before this, the sinonasal polyposis, how it will appear on the MRI. It is only mucosal hypertrophy, sinonasal polyposis. So it will appear as the same signal of the mucosa on T2. The mucosa on T2 weighted images is of high signal, hyper intense. Okay, so the mucosal polyps will be of high signal on T2 weighted image. How to distinguish between chronic sinusitis and acute sinusitis? Chronic sinusitis will show mucosal thickening. So once you detect mucosal thickening, this is chronic sinusitis. Okay, once you detect mucosal thickening, this is chronic sinusitis. However, if you detect air fluid level within the sinus, this is acute sinusitis. So here, mucosal thickening within the sinus equals chronic sinusitis. Okay, so this maxillary sinus polyp can be associated with other polyps or mucosal thickening in the other sinuses or in the nasal cavity. So here, the left maxillary sinus shows mucosal thickening, indicating chronic sinusitis. In this case, this is the fungal material of low T2 signal inside the sinus, and it is surrounded by mucosal thickening. The mucosal thickening shows high T2 signal and post-contrast enhancement. So once you see this mucosal thickening in the maxillary sinus of high T2 signal and showing post-contrast enhancement, this is chronic sinusitis. Okay, chronic sinusitis with fungal infection, with chronic allergic fungal infection. Okay. So here there is air fluid level in the left maxillary sinus. Okay, there is air fluid level here in the sphenoid sinus. So this means that this is acute on top of chronic. Why? Because this is acute sinusitis and there are areas that show mucosal thickening. So this is acute because of the air fluid level on top of chronic because of the areas of mucosal thickening. Okay, acute on top of chronic sinusitis. So here acute sinusitis occurs, okay, with fungal material. Can you see the fungal material here? There are areas of high density, inside the maxillary sinus. Can you see this area of high density? Yes. So this is chronic allergic fungal sinusitis. Okay. This is acute on top of chronic inflammation of the paranasal sinuses, exhibiting the criteria of fungal infection. Okay. However, here this is chronic inflammation of the sinuses, exhibiting the criteria of sinonasal polyposis. Sinonasal polyposis. So the differential diagnosis of complete sinus opacification. Once you see complete sinus opacification, remember this lecture. Complete sinus opacification, remember this lecture. The first possibility of complete sinus opacification is chronic allergic fungal sinusitis. The second probability of complete sinus opacification is chronic sinusitis with sinonasal polyposis. The third possibility in the upcoming lectures will be mucocele. So, this chronic allergic fungal sinusitis is a type of infective sinusitis. So, what are the causes of infective sinusitis? Infective sinusitis could be due to bacteria or fungal. Okay? So, we have two types of fungal sinusitis. The first type is chronic allergic, okay, fungal sinusitis. The second one is invasive fungal sinusitis. The chronic allergic fungal sinusitis will show no invasion, no bony invasion, no intracranial or intraorbital invasion. However, its main problem is the marked sinus expansion and bony thinning and bony erosion. This is its main problem. However, there is no invasion, no bone invasion into the intraorbital or the intracranial cavity. However, in invasive fungal sinusitis, there will be bone invasion with intraorbital and intracranial invasion. Invasive fungal sinusitis. Okay. The management, both lesions here needs to be removed. Okay, surgically removed. Both lesions, especially the fungal infection of the sinuses, it needs to be removed. Okay, so it needs ENT surgery referral, as the management is typically surgical. So I think that's it.